and approach. Just to be clear, also known as the Marin County Breakout Session. My name is Folake Phillips, and I'm the founder and executive director of AWO. Our goal today are very simple: to share, learn, and discuss unique COVID-19 vaccination issues, other solutions, and unique needs as relevant to Marin County's African Americans. To listen, engage, and facilitate dialogue specifically between Marin County's Black representative and the county's Black community members. Also, we present opportunities for networking and resource directing. This session's guidelines too are simple. The session is being recorded, and recording will stop immediately the panelists are done presenting. During the session, please send any questions you have for the panelists to the Q&A box. We will try our best to go through everyone's questions while we will mind the time set strictly for this breakout session. There will be additional resources and links up on covid19black.org. We would like everyone to head back to the main webinar right after the breakout session has ended. Our order of program for today's session is as follows. We will start with the panelist session for about 12 minutes. This will then be followed by an audience Q&A for 20 minutes. I will be moderating this session. Audience members watching are invited to type in and submit their questions anytime during the session via the Q&A box at the bottom of your webinar screen. Our panelists for today's sessions are as follows. Benita McLaren, Director, Health and Human Services at County of Marin. Dr. Larry Smith, biologist, scientist, nationally recognized scientist, research and published author. Liz Darby, Social Equity Programs and Policies at County of Marin and community advocate. Now, let's hear from them. Benita, the floor is yours. Thank you.
Thank you so much. I really appreciate the opportunity to be here with our County of Marin residents and with our panelists, the esteemed Dr. Larry Smith, and with my coworker, Liz Darby. I'm Benita McLaren, as mentioned, the Director of Health and Human Services here in Marin County. And when you go to the first slide, please. We have spent the last year working tremendously to prevent and diminish the impact of COVID-19 throughout our county. Since the beginning of March, when we started to see COVID-19 in the community, the African American community here has really rallied to protect themselves and to make sure that we had a minimal impact of COVID here in Marin. And we've been fortunate that we haven't seen as many cases as in other communities. 1.7% of all the COVID cases in Marin have been in African and American and Black residents. And these cases, of this 1.7% of these cases, of all the cases, the majority of those cases have been from Sausalito and Marin City. And as you can see that in the slide, that 2% of the cases were from Novato, 1.3% of the cases from San Rafael, and 8.5% of the cases from Marin City. Next slide, please. One of the things that I really want to show everyone, though, I think that even though I think we've done as an African American community here in staving off COVID, we have had some deaths. About 4% of all the deaths in Marin County have been in African American communities. And as Ben mentioned, this is really our biggest concern, to save lives. The thing that we believe now that can save lives is the vaccine that has come out in recent months. The cases are declining here in Marin, and Marin has done a really public health, along with all of our county partnerships, have done a tremendous job in getting the vaccine out. As a matter of fact, Marin County ranks #1 among medium and large counties for the number of doses administered. You can see in this slide that we have done a really great job of getting vaccine out throughout Marin County. Next slide. As everyone knows, we did move to the orange tier, which does give us some concerns though, because we want people to know that we're not out of the woods yet. We still need for our residents to really seriously consider taking the vaccine to make sure that we don't have another surge of COVID in our communities. Right now, we're seeing about among ages 16 through 45, about 11%. I'm sorry, you can't see the slide as well, but between 11%, 9 to 11% of folks, African Americans, have had their first dose and also have had their second dose. Among those who are ages 45 to 64, between 18 and 22% have had their first dose and second dose. And among those ages 65 and older, we have about total of about 60% have gotten that first dose of the vaccine. So we're looking for more interest in the vaccine. The vaccine is our way of saving lives and of preventing the spread of COVID. And so I'm going to turn it over now to Dr. Larry Smith, who's an esteemed colleague of mine, and he's going to talk a little bit more about the vaccine. Dr. Smith.
Thank you, Anita. Thank you for the introduction. And next slide, please. And what I'd like to start out with is letting you know that there are 3 currently available vaccines that have received emergency use authorization from the FDA in the United States. And these would be the 3 vaccines that you would probably get if you were to get vaccinated anytime today, tomorrow, the next day, whatever. The 3 vaccines are called Pfizer. This is a 2-dose regimen, so it requires 2 shots. The second one is by a company named Moderna. It's also a 2-dose regimen, so you would actually have to get 2 shots. With the Pfizer vaccine, the first shot would take place, and then the second shot would be about 21 days after the first shot in order for you to be fully protected from COVID-19. The Moderna vaccine would require about a 28-day period between the 2 shots. But approximately 2 weeks after that second dose for either one of these vaccines, you would be fully protected from COVID-19. A new vaccine that's come on the market is one by a company called Janssen or Johnson & Johnson. Now, this is a 1-dose regimen. So about 14 days or 2 weeks after receiving this vaccine, you would be fully protected. But it would still be important, regardless to which one of these vaccines you got, to maintain social distancing, wearing a mask, washing your hands, etc., to let these really kick in and work. You've heard probably that there are some different efficacies that have been associated with these vaccines. And I would say to you that the efficacy is not so important between these 3 different vaccines. What's really important is that they all are safe and effective. They will all keep you from developing a serious infection. They will all keep that we're done. With all 3 of these vaccines, there were no deaths. So it doesn't matter which one of these vaccines you get, they're all safe and effective. Next slide. On the next slide, we have a survey that was done by the Marin County Health Department. And they surveyed approximately 247 individuals. These individuals comprised all racial groups, all ethnic groups within the county. And the results from the survey showed that about 23% of African Americans were not open to receiving the vaccine. So an additional question was asked would be that the survey covered was, why were these individuals not interested in receiving the vaccine. And it turns out that of those who were not interested in receiving the vaccine, the biggest concerns were around safety-related issues concerning the vaccine. They wanted to know that the vaccine was safe. There were also questions concerning the side effects. Individuals wanted to know more about the side effects that were associated with these vaccines. And then they wanted to know how well these vaccines worked out in society. In addition, the survey pointed out some very interesting facts, one being that of African Americans who are up to date on their vaccines. So this simply means that they've taken all of their vaccines, the flu vaccine, meningitis, all of the others, that in this group of individuals, about 83% who were fully vaccinated, in other words, they've received all of their vaccines, that they were actually more open to receiving the COVID-19 vaccine. And about 48% of those individuals who were not up to date with all of their vaccines were somewhat less likely to support the COVID vaccine. So there was a real good correlation between those individuals who had received all of their vaccines and they were willing to take the COVID-19 vaccine versus those individuals who were not really up to date with all of their vaccines. They went on to ask these group of individuals what were some of their reasons for accepting the vaccine or not accepting the vaccine. And for the ones who wanted to take the vaccine, a very common thread was that they wanted to protect themselves as well as to protect their families. So this was very common in this particular group. If you look at the right side of the slide, there are two very interesting tables. Again, two more questions were asked, and these questions allowed respondents to actually give a number of different reasons. And at the table at the very top on the right, they asked the reasons why individuals were not open to receiving the vaccine. And as you can see on this table, there's a lot of information there. But as you can see on the table, they asked each racial and ethnic group why they would not be open to receiving the vaccine. And each group supplied their answers. They collated these answers and then segregated the answers based on the individual races. And they came up with a percentage of individuals who had somewhat of the same type of answer. And as you can see, looking at the two top lines on the first table, a lot of uncertainty about the vaccine was really one of the leading factors as to why some people were not willing to receive the vaccine. And if you look at the racial breakdown with each one of these columns, you can see that the answers were really very similar among all of the races. Of course, there are one or two exceptions, but for the most part, they're about 80%, 80%, 80%, et cetera. The second question was also very interesting. It was what might convince these individuals to get vaccinated? And again, there were a number of responses that you can see listed in the blue areas on the blue lines. And again, they were divided among the different races. They were tabulated and percentages were determined. And what you can see here, and I thought it was really very interesting, if you look at the very last line on the bottom table, it says that, I can't see it very well, but it has to do with influence from influence from very prominent superstars, if you will. And we often think that if we look at a football player or a basketball player getting vaccinated, we might follow in step with them. But as you can see from the answers that were generated, actually no one really paid attention to the superstars. And at the line above that, we often think of religious organizations doing the very same thing, and by religious organizations as well. Now, this may be flawed slightly because there were a small number of people who were asked, but the data still stands as published. And so with that, I'd like to take any questions that you might have concerning these vaccines at the end of this presentation. Next slide. And the next slide will be Liz.
Good evening, everyone. Can we have the next, please? Thank you. Hi, good evening, everybody. I think Dr. Smith is still on this part, but I want to thank you all for joining us here tonight. I'm assuming you are my fellow Marinites, my neighbors that I have been working with, hopefully for the last year, working on key solutions to help address disparities in our African American and Black communities. There are very and these were key solutions that the county embarked on to address ensuring that our African American Black populations were getting vaccinated. We have information about vaccines and address hesitancy issues. There are over 300 Marin County healthcare providers that provide information on how to provide strong recommendations to the county. There are approximately 200 community-based organizations, staff, and volunteers that provide credibility information to the county to help them better strategize on how to engage with communities. There's a community advisory board. We're currently developing an African American physician Facebook live page. We've trained our community-based organizations on how to create a buddy system to provide assistance to our residents as they are getting vaccinated. We're implementing strategies that reach our at-risk and older adult populations. And we've got some community-tailored point of distributions where people actually get their vaccines planned. But I also want to talk about a couple of other strategies that we've used. And one of the things that I think is really important for people in Marin to understand is all African Americans are not living in Marin City, right? We all know that the vast majority of African Americans and Blacks who live in Marin County actually live in San Rafael and in Novato. And within those groups, they are all not created equal. We have a Haitian community, we have communities of color who are low income, and we have African Americans and Black residents in Marin County that are very high income. And yet we do need some similarities, and one of which is what we've talked about, Dr. Smith talked about, and you've heard earlier, is vaccine hesitancy. And how to address vaccine hesitancy in the Black community has been a challenge that the county has been working on for months. A few months ago, we set up Outbreak, West Marin, and Novato to help develop outreach strategies that were specific to those communities. In Marin City, which is the one that I oversee, and we've engaged, for those of you who know Felicia, we've engaged other CBOs, and we've really partnered with the Marin City Health and Wellness Center to not only message to specific populations, but to get that message right. Right? Because some people don't want to hear that Black community, and all of that information that we've gleaned and put together, we are now sharing with other areas in the county to ensure that the messaging is really, really critical. In addition to that, we had 3 days of vaccines distributed or given to a group. And in 3 days, we had over 38% of the people that were vaccinated were African Americans in Marin City. And 75% of the people that we vaccinated were people of color. In addition to it, 75% of the vaccines that were given in those 3 days were people over the age of 40. So we know that we are targeting the right groups and the right communities. And while, next slide, please, and while it's really important that we work with all of our organizations and our partners, we also know this, and I guess this is consistent with what the chart Dr. Smith showed us, was that, next slide, please, is that This makes the difference, right? Having community leaderships, having people in your community step up, take the vaccine and say, we did it, and help people celebrate that. That in and of itself, we realize has made a big difference. While I'm working in that walk-up session, I'm hearing from people say, I heard Miss Susie got vaccinated, so I decided I was going to come on down here. Or my aunt, whatever. And my brother told me, Liz, you can. And that's how we get it done. So at this point, I will end this presentation and turn it back to our moderator and facilitator. Thank you.
Thank you very much.